People say a dentist caused them a lot of pain, infections, even pulled the wrong teeth. We told you at 6 about the patients who say Charlotte dentist did that to them. Our Allison Ladas uncovered state dental board action now. All new at 11, one patient told her that's not enough.
Loretta Williams showed me the x-rays.
The piece of metal right here.
Part of a dental tool that broke off deep in her gum. Williams says she didn't know it was there for nearly 2 years, but felt extreme pain after Charlotte doctor Richard Roll removed her tooth.
And it was just like I just had this sharp pain that just went from my mouth to my head. And so from then on, I just kept having severe migraines. Like every time I would try to eat on that side or drink anything, it was just like something was stabbing me in my gum. I was mad about it because I'm like, you trust doctors to do what's right.
Dr. Richard Roll's website touts him as the official oral surgeon of the Hornets, Checkers, and Charlotte 49ers. Williams filed a complaint about him with the North Carolina Dental Board. A consent order from the board this month shows 4 other patients complained about Dr. Roll's care, including residual pain, infection, and extracted teeth that were not supposed to be pulled. During inspections, dental investigators say they also found required emergency drugs missing or expired, no opioid reversal agent, and an AED that was not operational, with batteries that had been expired for 7 years. Today I went by Dr. Roll's Cornelius office.
I'm Allison from Channel 9.
And was told Dr. Roll planned to speak to his attorney before commenting.
I invest in my patients.
The dental board suspended Dr. Roll's license for 6 months, but immediately stayed that discipline, meaning his license is active as long as he adheres to probationary rules for 5 years.
That's like a slap on the wrist. That's like telling him it's okay to do things like this.
Williams now has an attorney, Danae Minor.
We can't go back in time and take away that pain, so the only thing that she can be offered at this point is compensation so that she could be made whole.
If I wouldn't have never went back and got those x-rays done, that metal could have probably still been in my mouth to today.
Now, those probationary rules include allowing the dental board to randomly inspect records and talk to workers, and he has to complete continuing education classes on clinical and sedation record keeping, emergency drugs, and also on follow-up protocols after operations. And this is not the first time we looked into Dr. Roll. We reported on him back in 2016 when 2 former surgical assistants filed a lawsuit. They said they were fired after raising concerns about what they call unsafe practices. Their attorney told us they settled for a confidential amount of cash.